patients, the more active they are, the more chance they have of injuring some cartilage in the hip called the labrum. Labrum pain can cause some pain within the front of the hip, and we see this a lot in young athletes.
The sports that we typically see: females, gymnastics, dance, soccer, hip-specific sports. Males, we see basketball, football, runners, people who are doing a lot of rotation of their hips.
A small percentage of them have actual anatomic reasons for their problems. They were developed, their bones developed in an unusual fashion, and so it makes it hard for them to be athletic and not damage their joint.
The dysplasia, most folks are born with. We think that it's actually a packaging problem in utero and mom's tummy. Some risk factors are female, firstborn, family history, all lead to higher risks of dysplasia.
A lot of these patients end up with a hip replacement down the road, and if we can intervene early in the patient with pain, with dysplasia, we could theoretically prevent them from ever needing a hip replacement in the future.
In simple terms, the hip is a ball and socket joint, and you can have deformities of either the ball or the socket.
Typically, it's either too much bone, something we call hip impingement, or not enough bone, which is known as hip instability or hip dysplasia. You need to correct the bony problem first and then fix the cartilage within the hip. So this typically is done with a hip arthroscopy.
And so what we're able to do is put little 4 to 5 millimeter instruments into the hip joint. We use slight distraction where we open the hip joint up, and we can go look around and we can treat whatever pathology that we need to treat from a soft tissue standpoint, a very low risk setting in a matter of 1 to 2 hours on an outpatient basis.
I'm so excited to talk about the International Center for Hip Preservation. It is a program where we've brought together some of the best physicians from around really the state and even the country to take care of patients that have hip dysplasia and other hip issues. We've really had the ability to bring these folks together and provide cutting-edge care focused on things like research, making sure they're getting the surgery that they need, and the outcomes after they get surgery. We've been able to do this in a very unique way where it brings different doctors' practices together and not just make it about one practice working on this.
Yeah, one of the unique aspects of this is not a lot of people are doing hip preservation surgery well. And so we get a lot of tertiary referrals throughout the region, the nation, and even throughout the world.
We each have something that we're good at. I think the thing that makes our team really good is that we're able to get together, do cases together, which is not easy to get 2 surgeons in the same room, and use our complementary skill sets to help patients with more complex problems. We're all sort of at the height of our careers. We're trying to advance a science that's relatively new, that being hip preservation.
Our goal was to build a center, an international center of excellence for hip preservation, where you can come with your family member or yourself and trust that we're going to take great care of you and treat you like you were one of our family members. We take great pride in patient care, and that's our #1 goal. And we're going to do everything that we can to provide the best outcome for each patient that walks in our door.
Hip pain is really omnipresent in a patient's life. It affects all facets. It's hard to sit, it's hard to stand, it's hard to sleep. So being able to treat these patients really makes a huge impact in their overall quality of life.
So if you're a parent bringing your child to see us, you can rest assured we all know what it's like. We all have young children in this very age range as we're speaking now. And so we know what we want them to have in terms of care, and we try and deliver that care for every patient that we have.
So in the end, our goal is to truly provide the best care for hip patients that we can, really reducing the amount of surgery they need and making sure that we're only treating them for the things that they need treatment for.